So thank you very much for joining us today for this interview.
My pleasure.
I was wondering, you just recently went through our functional restoration program. I was wondering, how did you feel like the program benefited you?
My typical day used to be sitting on the couch. This morning I was at water aerobics for an hour. I'm here now. Then I have my manicure, and tonight I will go to synagogue. So I'm like a new person. The physical therapy was great, taught me a great deal, but the mind-body connection was incredibly significant. That's what the program really is. It's the mind-body connection. It was learning that I'm not a person in pain. I'm a person who may have some pain. I'm not a person who has a bad back. I'm a person with a bad back. I'm no longer identified by my medical and physical condition. And that is enlightening. The meditation, peace, mindfulness and meditation has given me a whole new way to calm myself, to allow me to sleep better at night. I can't say enough about it, and everyone who knows me recognizes that something is very different about me. They all want to know what it is, and I tell them, and several people have said, get me information. That sounds fabulous. But it sounds fabulous because it's not about going to another doctor. It's not about going to another physical therapist. It's about being with other people and learning about ways to take care of yourself in a much different way.
That's beautiful. How would you, we get the question a lot, what is the program? If you were to describe it to other patients now, in your words, what is the program?
The program is a way to help a patient through that transition of medical care to living their life. And that transition is very meaningful. It's very emotional. It allows people to no longer see themselves as a sick person, but to see themselves as a healthy person. It's pain management, not with drugs. It's not about how much physical therapy or exercise you can do. It's about understanding yourself and thinking differently. I'm a big fan. I'm a big fan. I'd like to do it again. I'm not kidding. I got so much out of it, and I realized that if I were to go through it again, how much further I could really get. I mean, I miss getting here at 8 o'clock every morning. Having that reason to get up and get here at 8 o'clock every morning was initially the biggest goal, was just to get here at 8 o'clock in the morning. And I had a 40-minute ride to get here. But I was here at 8 o'clock every morning.
Yeah.
For 4 weeks.
Good for you. Yeah.
And I miss it now. I really miss it. I am still in touch with the people that I went through the program with. I got a call from Dr. Rosenblum to just check in with me. I'm seeing you today, which I'm very happy. Mm-hmm. It's created my own little special family. Mm-hmm. Wouldn't give it up for anything. It's just been spectacular.
Would you recommend the program for other patients?
I think that anybody who's reached their limit of medical treatment, but who still have pain or who are still on a lot of medication, can benefit from this. And I would send several people I know, I would encourage them to ask their doctor about this, find out about it, tell their doctor about it, because they're at that point where the doctor's not going to do anything else for you. They really can't. And there are certain medical problems that don't go away. I happen to have multiple sclerosis as well as a bad back. So for me, this has helped me in a lot of ways, physically and mentally and emotionally. I would send a lot of people here. You have to tell me how to get them here.
We will. Do you have any final comments?
I think anybody who feels like they're at their wit's end needs to find out about this, needs to know that there is a place to go where there are people who can help you and you don't have to be at your wit's end. I came in here, a 71-year-old, recently widowed, MS lady in pain. And I walked out of here that same person, but with a whole different attitude on life.
Nice. Beautiful. I love it. Thank you.
Thank you.